Presentation by Olabosipo Awojoodu. This presentation examines the primary challenges facing urban youth in Maryland and outlines evidence informed strategies to address them. The geographical emphasis at Baltimore area, PG County, that's Prince George's County, urban pockets of Montgomery County, and other Maryland cities. The structures for the study is with the definition and context. The key domains are education, health, housing, employment, justice, promising practices, and policy recommendation. The scope and definitions. For this analysis, we termed urban youth as defined as they refer to individuals aged between 12 to 24 residing in municipal and inner suburban areas characterized by higher population density and concentrated disadvantages. The time horizon are primary data and trends from the past 5 years with attention to pandemic era impact. The data sources are US Census ACS, Maryland State Department of Education, Maryland Department of Health, Department of Juvenile Services, HUD, and local program reports. The demographics and context are the urban youth populations in Maryland. The urban youth population in Maryland are demographically black, diverse. They are diverse in black, Latino youth, and disproportionately represented in many high poverty neighborhoods. Concentrated poverty, housing instability, and service desert in areas of health, educational support. Understanding neighborhood level disparities is critical for targeted interventions. The education challenges. Urban districts face lower education and lower graduation rates, elevated chronic absenteeism, and resource constraints. Resources from staffing, counseling, advanced coursework. Non-academic stressors include housing instability, food insecurity, trauma, and limited digital access. Compound academic risks. Effective responses include integrate academic support with family engagement, mental health services, and community partnerships. Youth unemployment and underemployment are higher in urban communities with barriers including limited local living wage positions, inadequate transit, and insufficient paid work-based learning opportunities. Scalable mobile models combine paid internship, apprenticeship with credentials, and employer partnerships. Mental health and behavioral health. Rates of anxiety, depression, and trauma-related symptoms among youths have risen. Service capacity in schools and communities is insufficient. Barriers include provider shortages, cultural stigma, and logistical obstacles to care. School-based behavioral health, mobile crisis teams, and culturally responsive services improve access and outcome. Substance use and addiction among the urban youth. These are one of the problems. Youth substance use trends include vaping, alcohol, marijuana, and increasing risks of opioids exposure in some areas. The prevention and treatment services tailored to adolescents are limited. Harm reduction strategies should be youth centered and integrated with behavioral health. Juvenile justice and policing. Disproportionate contact with policing and juvenile system persists for youth of color. Exclusionary schools discipline contributes to school to prison pipeline. Diverse programs, restorative practices, and robust reentry support reduce and promote positive trajectories. Housing instability and homelessness. Youth homelessness in urban areas include unaccompanied minors, couch surfing, and youth aging out of foster care. Effective interventions include rapid rehousing, transitional housing with wraparound services, and host home or family reunification programs when safe. Health and access to care. Gap in primary, reproductive, preventive, and dental care persist for urban youth due to insurance, transportation, and clinic schedule barriers. Expanding school-based health centers and community mobile clinics strengthen access and continuity of care. Digital divide and education technology. Unequal access to devices and reliable broadband undermines academic attainment, job search capacity, and access to telehealth. Sustainable solutions require device provision, subsidized broadband, and digital literacy training embedded in workforce and education programs. Community and environmental factor. Neighborhood level exposure, violence, limited safe recreation, air pollution, food insecurity negatively affect our health, the youth health and development. Investment in environmental remediation, green space, food access, violence interruption programs deliver population level benefits. Promising programs and case study. Effective Maryland examples include city-run paid youth empowerment programs, community school that co-locate services, and non-profit-led workforce and mentoring initiatives. Success factors: sustained funding, cross-sector partnership, youth engagement, and rigorous performance measurement. Any policy recommendations? Priority actions that should be taken: scale and sustain school-based mental health and community school models, expand paid work-based learning like internship, apprenticeship with transit support and credential pathway, increase youth-specific housing solutions like rapid rehousing, transitional support, implement diversion and restorative justice and comprehensive reentry services. Close the digital divide via devices, broadband subsidies, and digital skills training. In conclusion, urban youth challenges are complex and interdependent. Responses must be cross system, equity focused, and evidence involved. What is recommended should be convene a multi stakeholder task force, pilot integrated interventions in high need neighborhoods, and define clear metrics for short and medium term impacts. Thank you.